5 semesters, and they're kind of like a physician's assistant in human world, but be allowed to do spays and neuters and stuff. Can diagnose diseases but can't prescribe the drug, kind of deal. It's a weird,
almost like a RN, but like less than.
More than, because you'll be able to do surgery.
Oh shit.
And the whole.
So we've talked about veterinarian health, veterinary work, veterinary community, veterinarian many times. We're back here with Tadlock, and this is impromptu. He has no clue what's going on, by the way. Teddy, where do you see the vet industry going? A lot of times we become doctors, or technology, AI, it's impacting every part of every industry. But where is veterinarian health going?
I think it depends. I think there's a couple different answers. In Colorado is question number 1, because they just approved that veterinary physician assistant, I think is what it's called, the VPA, to where you would, somebody with a bachelor's degree then goes on to get a master's in this VPA, 5 semesters, and they're kind of like a physician's assistant in human world, but be allowed to do spays and neuters and stuff. Can diagnose diseases but can't prescribe the drug, kind of deal. It's a weird,
almost like a RN, but like less than.
More than, because you'll be able to do surgery.
Oh shit.
And the whole veterinary world's in a turmoil about it because nobody agrees with it. You're learning anatomy online, and then you're going to go cut a dog without ever doing one. Like, it's a liability.
Oh,
and
so they don't have to go and do, what is it called, residency in a sense. Oh shit, that is crazy.
It's kind of sketch, but neither here nor there. So that is question number 1. Question number 2 is just how big does pet insurance get? I think we'll decide how big veterinary medicine will continue to grow. Just the more that somebody has insurance backing as an owner, the more money they're willing to pay, statistically proven. Like, oh, I've got insurance, just do it. Like, I only got to pay 10%. I get all my money back. So I think those are the 2 big things.
Pet insurance and these damn PAs. That is interesting, man. See, these are good questions. And where do you sit on the side? I don't want to say on the sideline, but where do you sit in all this stuff, and how do you going to participate?
If it comes to Texas, we'll be fighting.
And why do you think that is, or why would that be?
Money. Colorado State University is the one that funded it, and they're the ones doing all the legwork. So if Texas A&M or Texas Tech decides to follow suit, but the AVMA is already against it. It's just the CVMA, Colorado one. We're kind of for it, kind of against it. Every other state's already expressed concern and distaste for it. So I think the next state's going to be Florida. That gets it done.
So you do see this thing becoming something that's national too then at some point,
and
as they prove that it's possible.
Until it's proven that it's too big of a liability and pet owners won't see those people.
So why not just add the kind of residency practice hour type thing to these, I guess, certification or degree in a sense?
I still don't think it's the right answer. It's like, and it's one of those, people already view veterinarians as less than MDs or DOs. Like, you show up late. If you don't show up 15 minutes early for those appointments, you get canceled. You show up 15 minutes late to a vet clinic, they're still going to see you. So you're already viewed less than. This is just another strawberry on top of just respect, or just how veterinarians are viewed. So I think it's not going to help that problem.
That's interesting. Well, part of my job is, if I were walking into a place and there were 100 vets, I would ask 5 of, like, who's like the top vets in this room. I'd ask them, hey, what are your thoughts about the industry, where it's going? A lot of times, think about industry and how things are changing or shaping, that you know how to position yourself from a business standpoint to be there to add value. And in this case, it sounds like one part is going to be confusing. The other part could be super beneficial long term.
Yeah.
And pet insurance, it's already a thing, but I think it's underutilized.
100%.
And as it becomes more clear about the benefits of it, and more people get involved, that industry will grow.
Yep.
And that's on our piece of paper to be involved in, to be clear. But I'm glad that you brought that point up, because that just justifies that we're thinking about the right things a couple years ago, if I'm being honest. And then meeting Tadlock, of course, kind of solidifies to stay on the right path, per se. Is there anything that pet parents should know? And that goes back to, I think, even one of our original videos. Hey, what should you be looking for when you go into a vet? And because a lot of things go wrong, and unfortunately there are many situations where dogs die at a place, and maybe you didn't even know that the person got qualified at Colorado to do some sketchy shit on your dog, ain't ever even seen blood before. You're like, my man, you ain't never seen blood before, and you cutting a dog and spanning it? That's crazy. But anything that they should know, man, when it comes to like assessing the I guess the right vet clinics and making sure the vets are qualified, like how does that work?
I think it's all personal preference on a bunch of it. Like, I have a lot of clients that like me, and I've got quite a few that don't. And it's like, all right, well, I'm not for you, and that there's nothing wrong with that. So a lot of it's just figuring out what is a public opinion of a clinic, let alone a certain doctor, and then you just gotta try it out. Like, not everybody's gonna be for everybody, but I think it just all goes, same answer still applies from before. Just, you just gotta figure it out. Do you like them? Do you not? You could be the favorite vet in a city. You go in there, and they don't like you.
Heard, my friend. Heard. Well, guys, for those that are now, this is probably more detailed talk, but stuff that him and I'll discuss. But you go, how do you position yourself? Where do you become an industry leader? The pet industry, in my opinion, is the Wild Wild West. We've been to super zoos and pet globals, and everybody's getting involved. The world don't need another treat. It don't need, I don't even know if it needs another vet. You need the right vets and vets working together. And there are a lot of great vets out there. I've met tons. We're here with one. If you're in the Texas area, especially from a reproductive standpoint, I would challenge you to come in here and see how much he could do for your dog or your pet or your program if you're a breeder. And the challenge is, most of you don't know what you don't know when this is a doctor who cares most about, about the dog and its quality of life. But I love knowing that we're thinking the right way and trying to position ourselves to be at the right place at the right time. And man, that's crazy about that Colorado thing. Mm-hmm. That's like going to a trade school and just then going into an operating room and trying to, hey, I can do heart transplants. And ain't like you banged on some metal and worked on some fake bodies, but you never even saw it before.
Five semesters online.
And how long does it take to become a vet?
8 years.
8 years. That's a good while. That's a good while. And they could do it in 5, or do part of what you could do in 5
semesters. 2.5.
Oh, 2.5 years. Oh shit.
Yeah.
Is there, outside of the vet, is there anybody in the hospital that can do spays and neuters?
No.
Let's see.
Like right now, the way Texas reads in terms of a licensed or a registered veterinary technician, they can close an incision, a skin incision that I make. Like a dog fight, I gotta do all of it. If I open up that dog for a spay or a foreign body, I can close the muscle wall up and walk away, and the licensed or registered veterinary technician can't close it. I like closing my own because it's what they see on the outside is what you did on the inside. So I trust how I close an animal. Nothing against how anybody else does it, but if something's going to happen, I want it to fall on me because I did it, not fall on me because somebody else did it. But that's the way the law is right now.
Interesting. And I kind of get I'm one of those all or nothing people too. And so it's like, you can't do partial jobs if you can't do the full job, so why do any part of the job? I do know that spays, neuters, even being here, there's quite a few people that do it, but they get it done, especially when you have those, what are those places called that take in rescue, like a rescue place? Mm-hmm. They send a lot of people here to get their animals done, but it goes back to, no disrespect to I want the Harvard doctor, if I can. You want the guy who was taught to think. People don't understand, a Harvard doctor isn't just a guy who learned to do a job. He was taught to invent and create and solve problems, and he was already a thinker when he got there, so he's going to potentially have more perspective on in crazy situations especially than an average doctor. And that's the difference between Harvard and Mizzou. It's just a fact. Your Missouri doctor's a great doctor, but that Harvard doctor, he's an inventive doctor 9 out of 10 times, and those are the guys like the guy who did the first surgery on the conjoined twins. You go, what was he thinking? I won't say his name because he went a little left field, but you get my point. Guys, take care of your dogs. Insurance is a thing. Be mindful of those Colorado doctors, it sounds like. And until next time, it's good to know, man.